Let's talk about some crazy, shocking advice that you really need to know to save people's lives. Hey, it's Dr. Stephen Loam, lifestyle medicine cardiologist, and in this video, let's talk about some shocking advice that I have for you that can literally help you save other people's lives. More than 400,000 Americans die every year from cardiac arrest, and it's only a 3% survival when it happens outside of the hospital. That's not a good number. I recently had the pleasure of being the keynote speaker at the David Heller Foundation's annual fundraising event. The David Heller Foundation is a not-for-profit organization that screens young athletes for heart conditions and buys defibrillators for local schools, so in case an athlete has a cardiac event, there'll be a defibrillator nearby to hopefully save their life. I was there with Greg and Michael, the two runners that I helped to resuscitate at the Monterey Bay Half Marathon November 2022. Check out this segment from the Today Show.
At the Monterey Bay Half Marathon, California's scenic coast is on full display. But for two men running this past November, the event became a race to save their lives.
Engine 12, medical emergency, 169 Ocean View Boulevard.
Just 3 miles in, 67-year-old Greg Gonzalez collapsed without warning. Luckily, running behind him was cardiologist Stephen Loam.
He had no pulse, he wasn't breathing.
This is a runner from the marathon who was running and fell, and it looks like there's CPR in progress.
Dr. Loam administered chest compressions until paramedics arrived with a defibrillator, jump-starting Greg's heart and transporting him to a nearby hospital. Knowing Greg was in good hands, Dr. Loam decided he would finish the race.
Once you finally saw the finish line, it must have been a relief until...
Well, yes, I crossed the finish line and then I heard somebody say, I think we need some help over here. And I looked over to the side and there was another runner down, laying on the ground,
not
moving.
To be kidding me.
That's exactly what I thought for a brief moment.
Cardiac arrest at the finish line.
Hard to imagine, only 2 hours after performing CPR, Dr. Loam found himself on call once again, as 56-year-old Michael Heilemann went down just after finishing the race.
He had a head wound, completely unresponsive, not breathing, no pulse. So I just said, okay, let's do it again.
In minutes, a race volunteer rushed a defibrillator to Michael's side, and Dr. Loam delivered a life-saving shock to his heart.
So check this out. Greg and Michael, who both had heart attacks during the half marathon, have never met each other, and they haven't seen Dr. Loam since he saved both of their lives. It's all about to happen right now.
Greg. So good to see you. I'm so glad you're doing well.
We're alive.
Yes, we made it.
Now these two men, strangers to each other, were about to meet the doctor whose heroic actions bonded them.
Great to see you both.
Great to see you.
You guys look great.
Thank you so much
Thank
for
you so much.
saving our
Of
lives.
course.
Give me a hug, man. I see the tears in your eyes right now. How cool is this?
Oh, it's the best ever. Second chance at life. Best.
What is it like, Greg and Michael, for you to be here with Dr. Loam?
This is a gift. Yeah, this is, yes. Feels like crossing the finish line.
I don't want to over-dramatize this, but the way the doctor described it to me is clinically you both, is this right, that they both died?
Well, you can essentially think of it that way. Without that intervention, yes, it would have been fatal.
What's it like to hear that?
It's giving me a second chance with my boys, and that's been the hardest part.
What's it like to see them now?
Even better. It's wonderful.
Are you a believer in miracles?
Now, I think to some degree, yes.
I'm not sure I was before, but I am now, absolutely. Total miracle.
Perfect person at the perfect time in the perfect place.
But wait, there's more. All three of them are planning to run the half marathon again next year together. And Michael and Greg, they're already bouncing back. They're walking multiple times a day. Dr. Loam wanted me to tell you guys this. He hopes this story encourages everybody to do their part to prevent heart attacks by maintaining a healthy diet and exercise and learn hands-only CPR. That's the heel of the hand in the center of the chest, pushing hard, fast to the beat of, you guessed it, staying alive. And as Dr. Loam says, you do not have to be a cardiologist to save somebody's life.
That's like a real miracle in Monterey. That is an incredible story. The fact that he was there made all the difference in the world.
And a great tip, too, for anyone who happens to be around. I mean, if you're running and you're not a cardiologist, I mean, just to know those tips is life-saving.
You never know what's going to happen. It gives me the chills to tell the story and to have been there with those guys.
And
it was so special.
Feel the emotion in their voices. Incredible, Jake.
Glad they're all right.
Jake, appreciate it.
What a wonderful emotional moment that was. What we did at the David Heller Foundation's event was speak to all the donors and give them our story to try to inspire them, motivate them, help them understand why it is that they were supporting such a wonderful organization. First, Greg came up. He gave an emotional speech about his experience, having had that cardiac arrest, getting resuscitated, and having a new life. Then Michael came up and he told his story, which was also very touching. I then got up and I told my perspective that as a cardiologist, I see this happening, unfortunately, too often. Now, maybe it's only been 2 times that I've actually done this outside of the hospital, but I've seen this happen thousands of times inside the hospital. When somebody is in the ER having a heart attack, we actually put the defibrillator pads right on them immediately in case their heart stops, so we can quickly defibrillate them. And you have no idea how many times I'm talking to a heart attack patient saying something like, "You're having a heart attack. We have to do a procedure to remove the blood clot from your coronary artery so we can restore the blood flow and save your heart muscle." When during that conversation, boom, all of a sudden the patient's gone. They go into ventricular fibrillation, a fatal rhythm. Their blood pressure drops to 0, they lose consciousness, but we just stand back and say, "Hey, everybody clear?" Shock, rhythm goes back to normal. Patient wakes back up and says something like, "Whoa, that was weird. Something just happened here." And we say, "Yeah, we know, you just died, but we got you back," because the rhythm ventricular fibrillation, universally fatal unless you shock the patient with a defibrillator. So it's so easy and quick when you have it already hooked up to somebody. It's almost as if nothing happened. Now Michael, the runner who went down at the finish line, we got a defibrillator to him within 1 to 2 minutes and restored his rhythm. He remembers seeing me over him, and what did he do immediately? He stopped the Strava on his watch so he could record the time for his half marathon. He was very awake and alert immediately and remembers everything. Now Greg, it took us 5 to 6 minutes to get a defibrillator to him, a little bit longer than Michael. Greg doesn't remember me standing over him. He doesn't remember anything until he was already on his way to the hospital in the ambulance. Now get this, Michael, the runner who went down at the finish line, his father had a cardiac arrest many years ago, and it took them 10 minutes to get his rhythm back. Michael's father doesn't remember anything until he was already in the hospital. So you can see the longer it takes to defibrillate somebody, the more the risk of brain injury, what we call anoxic brain injury. It's absolutely critical not just to preserve brain function, but also the quicker you get the heart back, the more likely it is that the heart's going to be okay with no major damage done. Now, all of you need to know how to do this, and it's so super simple. You don't have to be a cardiologist to save somebody's life with this. Check out this video from the American Heart Association promoting hands-only CPR.
Movie!
Sounds like
Slingshot.
Flying bird.
Flying bird.
It's definitely a romantic
Wait,
comedy.
what is my win? No,
You drink
Shirt Man. The Heart Attack sequel.
Falling down.
Ever happen to you? Harmless game of charades based on film titles turning into a sudden cardiac event? Bam! Shaklaki! No? What? Think you're better than me? Well, it happens, all right? It's a real life situation! I got my daughters here, call 911, push hard and fast, okay? Focus! And yes, the beat of staying alive really works. Shama! Disco can save lives. Yes, disco. Huh? Check it out. What do you think? What? Dance party!
So just push hard and fast in the center of the chest, call 911 so a defibrillator can arrive right away. If there happens to be one right there, send somebody out to get the defibrillator for you, hook it up. It's actually really easy to do. Anybody can do it. You just listen to the prompts, push the button if it tells you that a shock is advised, and you save someone's life. That's it. Now, while it's awesome to save somebody's life during a cardiac arrest, it is even better to prevent the cardiac arrest from happening in the first place. As an adult cardiologist, the biggest thing that causes cardiac arrest is coronary artery disease, clogging of the coronary arteries, which is what both Greg and Michael had. And it's so awesome that they both made a full recovery. And it gets even better. We know that guidelines for prevention of heart disease from the American Heart Association and the American College of Cardiology recommend regular exercise. And regular exercise can lower the risk of heart disease. It can lower the risk of diabetes, help you lose weight, of course, and it really improves outcomes. So do exercise. Exercise isn't bad for you, but diet is king. Both Greg and Michael were very good at exercising. Their diets weren't quite perfect. We recommend a whole food, plant-based diet per the guidelines. What that means is eliminating processed foods, dramatically reducing or eliminating animal-based foods, and dramatically increasing unprocessed plant-based foods such as fruits and vegetables, beans and lentils, whole grains, nuts and seeds. A predominantly or exclusively whole food plant-based diet. Try to keep it lower in fat. That's the key to prevention of heart disease, and I'm sure you've seen some of this in my other videos. If you have not, check out my video on lifestyle medicine and heart disease. Well, I'm super excited to say that both Greg and Michael are doing great. They plan on running the Monterey Bay Half Marathon again with me this November. I'll share all those details with you when the event happens. I can't wait. And the other thing I'm super happy to say is both Greg and Michael are following a nearly exclusively whole food, plant-based diet at this time, and I know they're going to do well. Well, thank you for watching. Don't forget to like this video, subscribe to my channel, turn on notifications so you don't miss my future videos. Learn yourself some CPR, eat plants, stay healthy. See you next time.